Hi, everyone. Welcome to a new episode on our People Power Health series. We are really excited and we are really happy on having Dr. Nisha Mehta today as our guest. And Dr., the first thing that I would love to listen and to talk to you about is when you get in a room and you are going to introduce yourself in that room, how would you introduce yourself?
It's a good question. So I wear a lot of different hats these days, but I'm a physician. I am a mother, a wife, also obviously, and then there are other things that are really a big part of what I do these days, and those are my roles as a physician advocate, as a physician speaker, and as a physician community organizer. And so nowadays I run the largest online physician community in the country, maybe in the world. I'm not entirely sure about that one, but certainly in the country on Facebook, we have 168,000 verified physician members between our two communities. And a lot of what I do these days is live and breathe those communities and really trying to make sure that we give physicians a safe space to be able to talk about things and then ultimately, hopefully, to create some real change in healthcare.
Amazing. Thank you. Thank you for that. And thank you for providing and creating these spaces for different clinicians to talk to each other. So one of my first questions is a little bit more related to a personal note, and it's when and how did you decided to go into medicine, into healthcare? Is there a story behind that?
Yeah, I mean, I don't know that it's necessarily unique. My father is a cardiologist, and I just kind of grew up every day watching how much he loved his job. My dad, nowadays, we talk a lot about burnout, and actually nowadays 70% of physicians would not recommend a career in medicine to their children. But back then, I think most physicians were very happy to see their children following in their footsteps. And so, for me, I kind of grew up watching how much my dad loved his job and how much of a great interaction he had with his patients. And it's funny nowadays, like sometimes at my talks, I'll talk about how as a kid, I was so embarrassed because my friends would have this game where, we grew up in a small community outside of Pittsburgh, in southern Pittsburgh, and we would go to the mall, and my friends had this game where they would wait and say, like, how many minutes will it be until one of Nisha's dad's patients comes up to her and says, like, oh yeah, how was your tennis tournament? Like, how did your debate thing go? And I would be so embarrassed because everybody knew who I was. But nowadays I look back in retrospect and I think, like, how wonderful was it that his patients actually, not only did he know their lives and their stories so well, but actually they knew him and his life well enough to be able to recognize my picture, from my picture in the office, like, oh, this is Dr. Mehta's daughter, and that they even knew what was going on in my lives, right? That was such a great sort of relationship. And so every day after dinner, my dad and I would go downstairs and play ping pong in our basement, and I would tell him about my day and he would tell me about his day. And it was just so clear how lucky he felt to be able to combine his profession with something that he was so passionate about. So for me, it was really just saying, like, this is really cool because I get to combine these things that I love in terms of science and, the pharmacology and the anatomy and the physiology, but I also get to, like, work with people and I get to make a difference in people's lives. And it's, I do think we are in this unique position as physicians to really be able to not view our jobs as just a job. And that's what I love about medicine, right? Is that there's so much more of like a passion and a purpose to what we do. I talk, and that's not the case for every field, right? Like I talk to so many of my other friends where their job is just their job and it's a paycheck. And, I've never once viewed my job as a paycheck, which, I definitely saw with my dad as well. And I wanted that, where I was like, yes, I know that I have to work for a living, but also I want to love what I do on a daily basis. And I saw that he had that. And that was kind of what pushed me into medicine.
Yes, exactly. Thank you for that story. And I think a lot of people that when we decide to go into medicine, that idea of loving what we do and working with people are definitely big things that inspire us into getting into medicine. Now, I was impressed by that number. 70% of parents that are physicians will not tell their kids to go into that. I mean, you just mentioned that you have children yourself, right?
Mm-hmm.
Have you thought about what will happen if one day they ask you about it?
Yeah, I mean, we've had this conversation a lot because my husband is also a physician. My husband's a surgeon. And, we talk about this all the time. I think like we personally would love it if our children went into medicine. But I think we've been fortunate to be able to have a career in medicine where we've really been able to create the life in medicine that we want. And so both of us are really happy in medicine. So at a time where a lot of people, I mean, currently 25% of physicians are saying that they would like to leave the field in the next 2 years, which is really, really scary, right? Whereas like my husband and I, if we could continue to practice the way that we're practicing right now, we would, I'm happy to be reading plain films and doing things that, when I'm 80, like I love what I do. But I also have the luxury of now being able to practice medicine on my terms. And that, I think that as long as our children went in understanding like this is a demanding field, it's going to have its challenges. But if you are intentional about how you pursue your career, you will be able to do it in a way that makes you fulfilled and happy. And that's really what we're trying to, even in my communities, what I'm really trying to foster is this sense of kind of, you know, don't go into your job just saying, I'm going to do what everybody tells me to do. Think about what it is that you want, right? And for so many doctors, that's such a hard thing because we've like, ever since we checked off that we wanted to be doctors, somebody has told us, these are the classes you have to take. These are the exams you have to take. These are the hours you have to work. This, and it's like all been laid out. And so when I talk to physicians who are feeling burnt out right now, the first question I always ask them is like, what do you want? Like what would the ideal life in medicine look like for you? And it's funny because most people kind of take a step back when they get that question because they don't know, right? Like they've never actually thought about it because it's always been laid out for them. And so, like one of the things that I always will challenge people with is saying like, okay, if nobody was telling you which hours you were working and what cases you were doing and exactly what would you pick for yourself? What would your ideal patient population be? What would your ideal hours be? What would your ideal responsibilities be during each of those hours? What are the things that you love? Like if you love research, are you doing enough research? If you love spending time with residents, are you doing enough of that? What are the things that you have to do to kind of make you want to do this for the next 10, 20, 30 years? So I still believe that medicine is an amazing field. I just think that people have to be a lot more intentional about the job that they pick and why they pick the particular job they pick, instead of just kind of taking the first offer that comes across their table when they're graduating fellowship. We know that a lot of people pick the wrong job for them. And we see a lot of turnover within those first 5 years of finishing training where people are kind of jumping from job to job until they find that right fit for them. So, I still think medicine's a great field. I would still send my kids into medicine any day. I would encourage them to really think about what it is that they wanted to get out of their careers and then pick fields that really allowed them to have that life.
Amazing. So now that you are mentioning this and about the importance of selecting, of choosing which way or which area of medicine a person is gonna work with, I could see in your website, in your post, that you talk a lot about balance, right? Mm-hmm. About having this balance between life and work, and I can totally see that you and your husband have identified how to achieve this. And when that balance is not achieved, what we find is what is named or called as burnout. Mm-hmm. Most of the time, because there is this unbalance in the work-life relationship. And I was wondering, when was the first time that you had some kind of contact with burnout, either maybe your life or in some colleagues? How was that?
Yeah. So I think as I went kind of further down training, I started realizing that, the way that my attending physicians were talking about their careers was different than the way that my dad had talked about his career, right? I think people were starting to feel a lot more of the pressures that were coming down the system, a lot more of the issues with the insurance companies and administrative burden and all of those things that contribute to burnout. And it just seemed like people around me were not as happy as the generation of physicians that I had grown up around, right? My dad was friends with a lot of other physicians. And so a lot of our family friends were other physician families. And there was a clear difference between how people were speaking about those things. And so I was starting to kind of notice that. But when you're in training, you're just kind of, you're in survival mode. You're going from one thing to the next, and you're not really putting a lot of thought into it. And the first time that I personally had to really think, what is it that I want, was after I had children. And all of a sudden it wasn't, you know, okay, I've got every hour to give to the hospital, and then whatever I've got left over is my me time, but I'll figure it out. All of a sudden it was, I have these other people that I also have responsibility towards, and it's actually important for me to equally, if not more, prioritize their needs. And then finding that inherent conflict in, well, the hospital wants you to put them first, and then also you have other obligations. And how is it that you can have the life in medicine that you want, where every day isn't an act of survival? And, so I started feeling, I think towards the end of fellowship and my first few years as an attending, I started realizing, like, wow, I wake up on Monday morning and I'm like, okay, I got to get through Friday afternoon. And that was a different feeling for me, right? I don't think I've ever actually experienced true clinical burnout, because I think I made the changes that I needed to make early enough on. But I think if I would have continued down that same pathway of sort of like, hey, I'm going to do work 60 hours a week, and then I'm going to try to have the life that I want, and I'm going to be married to a surgeon who's also working a lot of hours a week, right? It would not have gone well. So at some point, my husband and I sat down and we said, like, this is not, my husband and I had met in college, and I'm like, this is not the life that we pictured when we were dating in college, right? We should have more time together. We should have more time with the children. How are we going to make that happen? And we started sort of making some changes. But that feeling of sort of, hey, I'm doing this and I just need to get through it. That for me was a really big red flag, because I was like, wait, I chose this profession because I was going to love every minute of it. And now I'm just thinking, like, how do I make it to Friday? And I think that was a big change for us in terms of saying, hey, we need to be more intentional about how we structure our weeks, and how we find jobs that are going to allow us to do the things that we want outside of medicine as well.
Yes, and one of the things that we have noticed recently in the last 3 years is that the COVID pandemic has just shown us all the cracks and all the problems around burnout, and around maybe the lack of a proper way of taking care of us and of each other.
Yeah.
Have you noticed that in the last few years? What other comments could you give us about this?
Yeah, I mean, I think that a lot of things have come together in a really bad combination over the last few years, right? I mean, on one hand, we were asked to do a lot more with less resources, right? And against an enemy that we didn't fully understand, and we were just kind of thrown into, this role as sort of the public's protector, and yet, we were still figuring things out. And in the context of that, obviously, there were a lot of workflow or work staffing shortages. There was a lot of attrition within the healthcare workforce as people needed to reshape their lives to reflect the fact that their kids were at home, or, and so we were seeing dropout from the workforce on both, not just us, but also with our ancillary staff and with our nurses and, everybody that made it smooth for us to do what we do. And what that meant was that every physician ended up having more on their plate, either to cover for people that had left the workforce or who couldn't do certain hours, or to cover for the other things that they had normally had staff that covered those responsibilities. So I think a lot of that happened. And in conjunction with that, medicine has become increasingly corporatized. And so the amount of administrative burden that was also being placed just to get paid for what you were doing and all of those kinds of things was also increasing. And then the utilization of the healthcare system is just constantly increasing right now, right? We have an aging population that's living longer with chronic disease. And what that means is more imaging, more tests, more everything that all leads to, more work downstream for the existing members of the communities. And then as that burnout has worsened, it's a really bad cycle, right? Because as burnout worsens and more people make the decision to leave that system, then that leaves more work on the people who remain within the system. And then that just spirals and snowballs, right? So I think we're at this point now where we're in this cycle that's very dangerous, where if something doesn't change about how we provide care in this country and what our expectations of clinicians in this country are, that you're going to see more and more people leaving the workforce or cutting back their hours at a time where we really need more people, not less people. So that's the part that I think is really hard right now, that COVID really accelerated, but we were on that pathway for a long time before COVID as well.
Yeah, no. I totally agree with you, and I can see and I can understand how these situations that, as you mentioned, were already there. The let's say the industrialization of medicine and how different ways of getting payments was getting mixed with other stuff. It was just going there and drop by drop getting bigger, and then COVID came and completely blew away everything. My next question, doctor, is gonna move a little bit towards, is there hope? Like, can we find some hope in the middle of all of this? And we could definitely say that there has been not only the COVID pandemic, but also a burnout pandemic when people are quitting their jobs, are changing careers. Is there a possible solution or way that we could act together to find solutions to this?
Yeah, I mean, I think there is, and I say that not as like the perpetual optimist. I'm not an optimist by nature, but I think that, right, when you have people who care about the outcome, you have the ability for, and you've got smart people that really want to make changes. The question is how do we come together to advocate for those changes effectively, right? Because at the end of the day, putting, like, at least even just putting, like, let's not let this spiral more, just even to get that momentum to stop so that we can pause and address the underlying issues, is going to take a lot of restructuring for how we as a community think about our jobs and how we as a community step up and advocate for our rights, right? Like, that part is something that physicians have never really had to do before, right? We've never had to say no, and it's very uncomfortable to say no, right? Especially when patient care is at stake. Like the way our training is, it's, you drop everything to make sure that you do what is the best for the patient in that situation. And that part we don't want to change. But then what are the things that we can say no to, right? And what are the things that we have to say no to so that we can be present for our patients? And that's been something that I think for me has been incredibly vexing, but I feel like, we have to make the hard decisions at this point to kind of really say, none of this is going to feel comfortable, but we have to radically change the way that we perceive our roles as, advocates for our patients and for the healthcare system, in a way that sometimes we are going to have to say no. And sometimes we are going to have to fight back against things that we have conventionally not fought back against. And questioning some of the things that are coming down and saying, does this make sense? Like, are you achieving the targets that you are setting out to achieve by implementing these policies? Or are you just creating more work for us and more heartache for our patients? Or, are you actually taking away from the quality of care that we're able to provide patients by implementing some of these things? I think we've always kind of been head down in the sand. We're just so immersed in the clinical aspect of things. And it's going to take a big shift for us to say, hey, we have to take some time out of our clinical time to really think about the system and not let other people try to come up with solutions, because we know the system better than anybody else, and we know what we need better than anybody else. And we're going to have to take some time to advocate for that, because it's easy to complain, right? Like that's the easy thing for everyone, is to say this is hard and this is bad. But then the next step has to be, what are you going to do with those complaints? How are you going to channel that into productive action that's actually going to make a difference? So are you willing to have the hard conversations? Are you willing to think about how you're going to engage in advocacy on a higher level? Are you going to be willing to put your money where your mouth is and argue for the way that the rest of the world does, and we've just never done, right? Like, we don't have a great lobbying effort that we've put together, and how is it that we make sure that our voices are heard, and what does that take? I think that as doctors, we're kind of groomed to think that everybody's going to do the best for people whenever they can, because we're so groomed in this sort of Hippocratic oath method of like, obviously you always just do the right thing, right? And the rest of the world doesn't always work that way. And I think that's really like enchanting for a lot of us, but we also have to acknowledge that reality and say, okay, sometimes we're going to have to play that game too. And what does that look like? That's the hard part, right?
Yeah, no. I agree, and I love how you established and you mentioned that, for example, as physicians, we are used to a way of seeing things, doing things, and maybe something that we need to start learning is, as you mentioned, to say no. Sometimes we need to say no, maybe to establish some borders and some lines that we need to respect. But also one thing that you mentioned, and I think I also agree with that, is that we need to start looking into things in more than just a clinical way.
Mm-hmm.
So what are some of these other arenas, areas where we can take a look into, and how can we connect that into my almost final question that is related to this community, this online community that you have been creating through the last few years, and how does that connect, and how can we find opportunities there to understand better this new environment, this new world for clinicians?
Yeah. So, I mean, I think one of the things that is so important is to get our stories out there, right? Because a lot of us talk in these silos, right? And we assume that the rest of the world understands what our struggles are. But truthfully, like, most people don't understand what we're dealing with, right? They know their frustrations with the healthcare system, right? When everybody says healthcare is broken, everybody has a different lens on how healthcare is broken, right? And they see it from their perspective. So from the patient perspective, yes, there are so many frustrations right now, right? And when you see those frustrations, it's hard to know what the doctor frustrations are. So sometimes the patients will take out those frustrations on the doctors, and the doctors are like, we don't actually have control over this. This is an insurance company issue. This is not an us issue, or this is a policy issue. This is not an us issue. But part of that dialogue that needs to be created between patients and physicians and other clinicians is, what are we seeing that's wrong with healthcare, and what is it that we can come together to fight against, right? Because people don't know our stories, and so they don't understand, like, the things that we assume that they should know is unreasonable. We haven't done a good job of telling the outside world, this is why this is not okay. This is how this prevents me from being able to give good care to you. And this is why we together have to advocate for cause X, Y, and Z, right? So for example, when the pandemic hit, initially there was no plan to give money to private practices, right, in the stimulus package. So we were writing checks to the casinos, and we were writing checks to the airline industry, but we were not writing checks to physician private practices, right? And so part of what my community came together to do was say, hey, we have to support private practices, because the community, what we were seeing in the community was everybody saying, are you shutting down your practice? Are you shutting down your practice? Are you laying off your employees? Because if there's no money coming in, we can't run these practices, right? And we were having that conversation internally, but it wasn't getting to the government, right? And so when we talked to the government, it was like, well, why would we give money to doctors? Doctors make a lot of money. And we were kind of like, okay, but also the overhead for these practices is really, really high, right? There's a lot of expensive equipment. The staff is very expensive. And if we're saying nobody's going to come in for preventative care and they're only coming in if something is wrong, we can't run a practice in that way. And so if you don't support us, we're going to have to shut down our practices for now, and we're going to have to furlough our employees, right? And they were kind of like, well, okay, but they're not capable of seeing what the implications of that are, right? So then I had to kind of sit around and say, what you don't understand is if you shut down community care, now every time somebody's got a problem, they're going to the emergency room, which is exactly where you don't want them in the middle of a pandemic, right? Like, but that all had to be spelled out for the government, because they're like, okay, what's the worst case scenario? The clinic shuts down for a few weeks. Well, the worst case scenario is now I have a fever, my kid has a rash, and I'm going to the emergency room where I'm, encountering this unknown pathogen that none of us know anything about, and we're spreading this pandemic. Like, no, you need to keep those things in the community healthcare system. But we really had to spell that out in order to argue that we needed money, right, to be able to keep that going. And so we came together, we kind of put together all these points for these are all the things that we need during the course of this pandemic in order for us to do our job that you're asking us to do, right? You're asking us to be healthcare heroes, you're asking us to step up, but these are the things that you need to do for us to make it possible for us to do that for everybody that you're asking for. And so we put together, I think it was like a 17-page document that was like, these are all the things that we need. And we took it directly to, the heads at Congress, like the congressional leadership, and was like, these are the things that we need. And they actually held up the stimulus package for 48 hours and they got us $70 billion for private practices and hospital systems.
Wow.
But it really needed to, we had to kind of step up and take a stand. And at some point it did get a little bit dicey where we had to say, like, we're just saying no. Like, you're asking us to go into these rooms without any PPE. You're not willing to protect us or our families in any way, shape, or form. Like, there is a point at which we will say no. If you're going to give the goodwill to the casinos, but you're not going to give the goodwill to us, and you're asking us to put our lives on the line, like, you might be in a situation where doctors might strike, and that could happen in the middle of a pandemic. Like, that is not what you want, right? And that was really uncomfortable for a lot of us, right? Because, like, we wanted to help, right? This was our role, but also it was like, if you're going to be unreasonable and say that we should suffer either in our health or, threaten the financial viability of our practices, then at some point we actually do have to say no. And that, as soon as we said no, we got what we needed, right? But it's so hard as physicians to be in a position where, we value everyone's health above everything else. And so we give until we don't have a choice. And that was the first scenario in a while where we really didn't have a choice, where it was like, we don't have the money to keep our practices running. So you actually need to support us, or we can't do what you're asking us to do. And so I think that is the power of the community coming together, right? That is the power of people saying, these are all the things that we're facing in terms of challenges. And how do we make that understandable to somebody who's on the outside, right? What does it mean when your doctor has been awake for 18 hours and has been, asked to do all this paperwork when they get home from work at the end of the day? What does that mean for the quality of care that you're receiving? What does that mean for the frequency of medical errors? What does that mean for, the ability that they have to do the research that they need to do for your unique situation? So, addressing physician burnout is not, hey, let's make the physicians happy. Addressing physician burnout is a health policy issue that threatens our very ability to provide healthcare in this country. And if you look at just the problem with physicians is they don't say no, and then they quit. And that's exactly what we cannot have, right? Because they're afraid to say no. And so they work as hard as they possibly can until they hit a breaking point, and then they leave. And it takes over a decade to train a physician. So your pipeline there, every time you let somebody leave the system, you are creating a deficit that takes 10 years to fill. And that's really important for us to get out as a community to organizers and say, you don't understand, you're creating a system in which in 5 years, we are not going to have basic medical care in a lot of the country because there aren't going to be the people to give it, right? And if you have a year like 2021, where 117,000 physicians left the workforce, that is over 10% of the workforce that left in 1 year. So when you think about what your runway is, before you just don't have enough doctors in the country to provide even basic levels of what we've come to expect as a nation as standard of care, you start getting into some really dangerous territory, right? I look at the number of people leaving and I'm scared about who's going to provide medical care to me in 10, 15, 20 years whenever I need more utilization of the healthcare system, because I look at just the amount of attrition and it's sort of is it going to take me 6 months to see a doctor? And, when I do see that doctor, are they even going to have the capacity to be able to help me? And that's a question that every patient in this country needs to be asking themselves right now, right? It's not oh, these doctors are just complaining about being stressed. It's, oh gosh, if we let all of these clinicians, doctors or otherwise, leave, then how do we expect healthcare to, like when we walk into the emergency room, are we going to be able to expect that somebody is going to be able to help us? And like the answer to that has always been to taken for granted, yes. And it's like, now you can't take that for granted anymore. And that's really, really scary. I don't think it's like clear to people, how bad of a problem it is that people are leaving the field and what that means. And there's just so many demographic issues in terms of the shortages that are only going to amplify as you go on. If you look at who the demographics of the incoming physician workforce, and then you look at how quickly people are burning out and so 40% of female physicians will actually cut back clinically or leave medicine entirely within their first 6 years of finishing, or for 7 years of finishing training, right? And if you look at the fact that 50% of the incoming or the outgoing passes from medical school are female, and you think about the fact that 40% of them are going to cut back or leave medicine in the following years, and not even last a decade within the system, those numbers just keep getting smaller and smaller in terms of how many physicians that you have left within the workforce. And then you look at it on the other side and you think about how many people are talking about retiring early, or who are frustrated, or who want to cut back, or who want to do something that's completely unrelated to medicine. And those numbers add up so quickly in terms of attrition, that it's hard to see a system, if we keep going down this trajectory that we're going, where we can have any sort of sustainable medical system.
Yeah, no. I, as you mentioned, I can totally imagine where are we going, but as you said, there is definitely hope. There is a way in which we can do things differently. If we come together, if we talk to each other, if we raise our hands and let the government know what needs to be done in order to fix the issues that are there. Wow, this has been a really, really interesting and amazing conversation, Dr. Nisha, so far. And just before we finish our conversation and our call here, I would like to ask you maybe some couple of quick questions, because when we finish our interviews, we usually ask our guests if they can share with us either a book that they find inspiring, or maybe a movie that they watch when they want to get their spirits up and motivated into going and working and doing stuff.
Yeah.
Is there any kind of media that you love that you will share with our audience?
There's so much. There's a lot of, I'm trying to think of one resource that I would recommend over others. I mean, lately I really have been using LinkedIn a lot, because, and the reason that I have been doing that is because I obviously am very biased and think that my communities are a great place, but what I want to encourage all physicians to do is to get out of our echo chambers and start listening to everything else that's going around, right? And the reason that I love LinkedIn so much right now is because I feel like I can hear, healthcare is a huge industry, right? It makes up 20% of our GDP, and there's a lot of players in it. And in order to change healthcare, you have to understand, what are the business people thinking? What are the other allied professionals thinking? What is coming down the pipeline in terms of health tech, and what is coming down the pipeline in terms of AI? And how do you put all of these different things together to create some innovative solutions to a very big problem? And so right now, that has been a great place for me to kind of get all of these different viewpoints from all the different, angles, such that I feel like you can kind of put together a more comprehensive picture of what healthcare is in this country right now. Because, to our point of what we've said before, we all exist in our silos. And, to me, healthcare as a radiologist is me sitting in my room looking at a bunch of images, right? To somebody else who's a primary care physician in a rural area, they're looking at a completely different vision of healthcare. But the solutions that we have to come up with are going to have to cross so many different platforms that I think it's so important to just be looking everywhere and understanding what the entire landscape means. So it's hard for one book. I would say read a lot of books, right? Written by different people, one by an entrepreneur in the health tech space, one by, somebody who's in the insurance world, and get a sense of everybody's different perspectives, so that you understand it's not going to be one profession that solves this problem. It's going to be a lot of people coming together.
Thank you. And before we close the call, one last message for physicians, for people that are out there that are thinking about either burnout or about what they should do or could do with their careers. Any word of advice or comments that you could share with us?
Yeah, I think the one thing I would say is not to, there's a lot of doom and gloom out there right now in terms of just people giving up hope, right? That's part of one of the essential, like 3 pillars of burnout is sort of a cynicism and feeling like there's nothing that you can do to change things. And what I would say is like, this is our profession. These are our patients. We owe it to ourselves and our patients to create the best system that we can. And it's okay to get uncomfortable, and it's okay to do things that haven't been done before, but you've spent a lot of time getting to this point where you have the privilege of being a physician. Do whatever you can to preserve your right to be able to do that for the next 20, 30 years, right? Don't just drop out and say, this isn't for me. Find a way to make it work for you and create the life in medicine that you want so that you can fulfill your passion.
Thank you. Thank you very much, Dr. Nisha. Thank you for joining us today. Thank you for your words. And thank you everyone for joining us on our new episode of the PPH interview series, and see you next time.
Thank you so much for having me.